Hello, my name is Chirs Carmody. I'm Senior Vice President here at UPMC, the University of Pittsburgh Medical Center. I'm responsible for many things related to our technology infrastructure, supporting both the domestic and international sites of UPMC. I'm here today to talk about our cybersecurity and how we deal with it in the era of virtual care. Many of us have experienced the impact of the COVID-19 pandemic and how we've had to transform the delivery of patient care. I'd like to share with everyone the journey that we went through at UPMC and some of the challenges from a cybersecurity perspective, which many of us, if not all, are dealing with, and how we can help better deal with it as we move forward and the adoption of virtual care and the expansion of it moving forward. So UPMC, when COVID-19 hit, we had virtual care occurring over many years. It wasn't a new technology. It wasn't a new approach. It just was not widely adopted. And that was okay. But it was there. The technology was there. So as we made this transition to deal with the pandemic and keep everyone safe, we saw a 50-fold increase in the number of virtual care visits across UPMC. Pretty staggering, especially when we saw it happen overnight, basically. So in 2020, holistically, we had over 1 million ambulatory telemedicine visits. We're now conducting as many visits in one day as we were previously over a 6-month time period. And that was as late as in 2019. So truly a transformative event with COVID-19 and the impact on how we were delivering essential care and services to all of our patients everywhere, keeping both them safe and our clinicians safe in performing that work. From an IT perspective, we were very busy at the onset of the pandemic, deploying many devices, over 2,000 across Western Pennsylvania, which is our primary location for many of our care services. Over 150 telemedicine cameras and speakers and video clients were deployed across all of our cancer center locations. And we continue to provide that support and deliver additional technologies to support both inpatient and ambulatory sites. And that was the interesting challenge as well. You typically think about virtual care as something being the patient being remote and the care provider being at organizations' sites as they provide that care. COVID presented a different challenge with that by forcing us to be able to support our care providers and our patients to be able to connect not at any specific location at all. So that is where we saw the challenges from a security perspective, from a technology resiliency and availability perspective, and ensuring that we are able to continue to provide that service. Lastly, we saw a huge shift from all of our workforce who weren't directly providing patient care within our hospital facilities. So basically, over the course of a long weekend, we transitioned about 78,000 people within our workforce. So providers, including doctors and nurses, as well as our back office staff and even IT, shifted from working on site at over 2,000 physical UPMC locations to now working remotely from their homes. So again, connecting those people, those patients, and our staff was a huge challenge, and which many of you had faced, but a great opportunity as well to use the capabilities of virtual care to enable and provide that care no matter where someone was. So it really was a great opportunity to fulfill that vision that we all have had with telemedicine and virtual care over the past couple decades. So with this growth and expansion of virtual care, we also have seen a lot of cybersecurity challenges. And depicting this is the example of a fence, a perimeter. In technology, we all stood up firewalls and other technologies to block traffic coming into our networks, into our environments, to keep those bad actors out, to protect our data and digital assets within our organizations. And as I mentioned, the shifting of the remote workforce really started to open up and break down some of those protections, those safeguards and controls, as well as the use of third-party vendors. A lot of the new technology and applications no longer are acquired and implemented on site within your own data center of an organization, but rather at that organization's location in the cloud. And a lot of the services that we now provide and we were moving towards are cloud-based. So that perimeter control and protections and everything we had built over the years from a cybersecurity protection perspective, we're now shifting and changing because of the reliance on providing services like virtual care, like supporting our remote workforce. So some of the real examples that we've faced from an IT perspective and cybersecurity perspective were the use of new technology and platforms. Everyone's very familiar with Zoom and probably the term Zoom bombing, which is when a bad actor, the bad guys, try to infiltrate and take over different sessions, whether it be a one-on-one virtual care visit or the typical virtual conferencing that has occurred over the course of the pandemic. In addition, Zoom really wasn't prepared from a cybersecurity perspective. They promoted that their platform was secure and provided the privacy protections to protect sensitive data like patient information, but they really didn't because they were taken by storm, as were all of us, with the huge growth and adoption of the technology platform. And Zoom ended up admitting to the US government that they had misrepresented their security capabilities and have worked very diligently to protect their platform. But that doesn't mean that they're done, nor does it mean that any other platform that is being used from a virtual care perspective is always secure and always safe. So some more recent examples that have impacted the healthcare industry and really the ability to deliver care we've seen across different countries and with specific technology platforms. So the HSE in Ireland faced a cybersecurity attack that took them down. And then a vendor, Electa, from a cancer treatment perspective, really impacted the delivery of care and cancellation of many cancer services. These are the type of events that we have to protect against. So all these new dynamics from a virtual care perspective pose increased security risks. And we've seen that, and we're going to continue to see that, whether it's data breaches or phishing attempts or malware or ransomware attacks. That evaporating perimeter that I depicted with the fence with many holes through it is really presents new challenges to us to expand our networks, to expand all the connectedness into the cloud and all the different services and technologies. And that has exponentially increased the attack plane that we now have to try to protect. So what do? How do we face this challenge? How do we better prepare the organization so we can get back to our focus, which is ultimately providing patient care in a very convenient and easy way from a virtual care perspective? So in order to address and deal with how we protect the delivery of virtual care, we like to break it down into three areas: people, process, and technology. Starting from a people perspective, we're all very familiar with the training and awareness campaigns that occur across your organizations. We need to expand that, if we haven't already, to not only include our employees, our staff, our physicians and clinicians, but also to our patients, to help them be aware of what they're doing and what the risks are and how they can protect themselves when they engage in a virtual care visit. Specific telemedicine training regarding security and awareness is also needed and specifically required for our staff, for any care provider that engages in virtual care, and really highlighting not necessarily only what to do or how to do it, but also what not to do. When the pandemic struck, we saw many physicians, many clinicians utilizing their own personal devices, their own home PCs, in different technology platforms outside of what our standards were. So making sure they're aware on why why we use specific technology platforms and systems is important, and not to go outside those bounds because of the security risks it presents to the organization. From a process perspective, um, probably the most important, most impactful thing we can do to continually protect virtual care is when we're looking at new technology and introducing things into our environment, is to do the rigorous evaluation of it before we purchase it or before we implement it into our environments. And that includes looking at things as the security posture of an organization, whether they subscribe to best practice frameworks like ISO or NIST or high trust, whatever they're doing to protect the delivery of that service and protecting your organization and your patients' data, since we're now sharing it and enabling it within their own environment. Comprehensive contract terms are so critical to fully protect your organization in the event of a security incident, data loss, service outages, or just poor performance, because we're now relying upon other components that are out of our control, quite frankly. So it's critical to ensure you have the right contractual language to protect your organization. What we like to do at UPMC is install very strong, very explicit service level agreement key metrics to ensure that our expectations are met and we hold our technology partners to a high standard. From a governance perspective within the organization, again, getting back to the policies and standards to conduct those virtual care visits, that's a living, breathing set of documents to provide that guidance and support to our staff, to our clinicians when they're conducting those virtual care visits. So it gives them a reference point on what to do and how to conduct virtual care sessions, not only just securely and safely, but also to be efficient and effective in providing that care. And then lastly, from a process perspective, something that we never want to lose sight of is just good information technology hygiene, which means we want to use those best practices and basic practices to protect our organizations and protect our environments. So things like change control, testing our environments before we apply a patch or a fix, making sure that we do good identity management and securing our environments and utilizing different technologies that are basic, just like installing and utilizing strong passwords on accounts or multi-factor authentication in cases when you're dealing with access outside of your environment are so critical to protect that virtual care visit and that virtual care session. And then from a technology perspective, which is highly influenced by the people and process, dealing with those new technologies like medical devices and wearables. So virtual care is at a state where we're relying upon these platforms like Zoom, like Microsoft Teams, like more specific ones to healthcare like VidYO. And as we start to see patients use wearable devices, that presents new challenges to how we want to protect and ensure the integrity of that data in that session of providing that virtual care. Identity management, again, is very critical to ensure that we have the right patient, not just protecting the staff and the physician with access into the environment, but also being able to protect that patient that we're providing care with. So we're able to provide authentication. And from a B2C perspective, the mobile device management. So we're utilizing devices that are no longer a company asset. And a lot of times we're using smartphones and devices, home PCs that are accessing these services. And we want to make sure that we're able to provide that protection from a software perspective to ensure a safe and secure environment and session. And then lastly, from a technology perspective, just to highlight, we want to monitor what's happening on the lines, what's happening from a network performance perspective to ensure that we have resiliency, because we see many disruptions as people work from home and again, patients seek care from home or other locations. That disruption of that service is critical. So we want to make sure that we're able to be resilient and be able to recover or have alternative means to provide that access. And part of all of that is the continuous security monitoring. So when we see ransomware and other types of attacks that try to impact our environment, we want to be able to protect against those, or at least detect them as soon as possible so we can take the appropriate actions to recover and restore services to continually move forward. So despite all these challenges, from a people, process, and technology perspective, they certainly don't outweigh the benefit of providing virtual care. We as IT professionals and as physicians and care providers that are leveraging technology platforms from a virtual care perspective, all have to buy in and all have to be willing participants to ensure that we provide safe and secure environments to protect patients and to continue to leverage a great technology to provide care that, quite frankly, we weren't really utilizing enough before the pandemic. We foresee a bright future in the use of virtual care, not just across a particular city, but across the world, and being able to extend our services from a care perspective and from a specialty perspective. So it doesn't matter where you're at. We want to provide that safe, secure session and connect a patient to the right provider at the right time in a very secure way. Thank you all for the opportunity to speak with you today. I look forward to participating in this virtual care event